listening to the myPET podcast, the show for pet lovers of Australia and around the world.
Hi, you're listening to the myPET podcast. I'm Aria and I'm with Dr. Glenn.
Hello.
He's our vet. So we're here to discuss my least favourite of all of the worms, the tapeworm.
Poor tapeworms.
I have no sympathy for them. They are cunning and they are smart and they are creepy and gross. And that is why we're here with you, so you can tell us how we never have to encounter these horrid little things.
You don't want them in your life, yes.
No.
Yeah.
No, I don't.
And neither does your dog or cat. Yeah.
No, absolutely not. So before we get started, this is general advice. So for advice specific to your pet, have a chat with your treating veterinarian.
Sounds good.
So there are a number of different tapeworms in Australia. That's right?
Oh, there's lots and lots, but the main ones that we worry about for dogs and cats, yes, there's a couple that we are concerned with.
Yeah.
Yep.
And it can be, this is why I say they're cunning, because it can be a little bit confusing to know what to do for each of the different ones. So
yeah, there's a dosage difference between the different types of tapeworms. I mean, they're infective and they can cause infections in both dogs and cats, and some of them are species specific and some of them aren't species specific. Mm-hmm. And because they've got a fairly convoluted life cycle, sometimes they have different effects in different animals, basically.
Mm-hmm. Yeah. So we're going to break all of that down.
Sounds good.
So the life cycle, it's actually pretty fascinating.
Yes.
So can you explain maybe the flea tapeworm, how their life cycle works? Because that's the most... Do you most commonly see that?
That's the most common one I see, and it's the simplest life cycle as well.
Yeah.
So, I mean, the flea tapeworm basically just goes between a cat and dog or the flea. So there's no one else involved. As we'll find out later, there's sometimes other animals involved, basically. So the flea tapeworm, dog has a flea. That flea has got the tapeworm eggs in it, and the dog chews on the flea and ingests them, and this is the way the dog gets infected. The dog has tapeworms that grow inside its intestine and colon, and the little segments or eggs get pooped out and go into the environment on the ground, and flea larvae hatch out, and part of their life cycle is to eat the poop of mostly fleas, but also they eat all sorts of organic matter, including dog poop.
Disgusting.
And then that flea takes in the little flea tapeworm egg and jumps on and bites the next dog or cat and gives that one tapeworms. So yeah, it's a reasonably unconvoluted life cycle compared to some of them, but that's how they get it. Yeah, so if your dog's got fleas, if your cat's got fleas, they can get flea tapeworm.
And that's why it's important to prevent and treat fleas.
Correct.
One of the reasons.
Correct.
Yes. So treatment for a flea tapeworm, what does that involve?
A single dose of the tapeworm in dogs kills the flea tapeworm, basically. Cats can get infected with the flea tapeworm, but it's fairly uncommon. Okay. But basically the dogs, it only takes a single dose to kill any tapeworms that are in the system. There's no residual effect from any of the tapeworming medications that we use, which is basically praziquantel. So it kills the tapeworm adults that are currently in the system, and you need to do it frequently enough that it prevents the tapeworms from causing any problems. You can't keep them sterile of flea tapeworms because you'd have to dose them every day basically to stop them becoming infected every day. But the easiest way to stop them from getting flea tapeworms is to not have any fleas as well. So it's a combination of very good flea control, so your dog isn't getting flea tapeworms, but also you can kill the flea tapeworms when they're in the system. Yeah.
Okay.
Yep.
Yeah. So if just to recap, if we've got fleas, then we should do a treatment with a product with an active ingredient called praziquantel.
Yes.
And then treat with that, work on preventing the fleas, and then you should be also preventing the flea tapeworm.
Correct.
Cool.
So if your dog gets any fleas, basically you can get flea tapeworms. So if you're using a long-term prevention that stops them getting any fleas, well then that makes flea tapeworming less important. And there's a number of the flea products that we've got now that are long-acting systemic medications that stops fleas in their tracks, basically. So in that way. There's a couple of them that have got registration for preventing flea tapeworms.
Yeah.
Doesn't actually kill the flea tapeworms, but prevents flea tapeworms. So for me, it's really important, like if you get a puppy and it's had fleas, or you're not sure if it's had fleas before, like if you get it from the breeder and you haven't been the one that's given a tapeworming dose, I think that's important to give a tapeworming dose, because you don't absolutely 100% know its history previously. But from there, if you're on very good flea control with the Brevectos and Nexguards and Simparicas, it's unlikely that they're going to get any flea tapeworms after that.
Yeah, awesome. So what about the more convoluted tapeworms? What do you mean by that? Sounds ominous.
Yeah, I mean, Spirometra is a pretty common tapeworm.
Okay.
When I say common, like I see it clinically in practice in both dogs and cats reasonably frequently. It's a crazy little one that goes through a little water flea, so a little microscopic organism that runs around in dirty water, basically.
Wow.
So that's the starting point of where that tapeworm comes from. So if the cat or dog poops in the environment and some of that poop ends up in water, which happens all the time, that little egg from the dog's poop or the cat's poop ends up in that little flea, and anything that goes up the food chain basically that eats that little thing, so it's probably another microscopic organism that eats that, and then a slug or a snail or insect of some sort eats that, and then anything that eats that insect, so that brings birds and mice and rats and slugs and other bits and pieces into the fray, and then whatever eats them, which is often cats or sometimes dogs that eats basically lizards, snails, slugs, skinks, anything that eats anything else, basically. So that sort of joins the chain of that life cycle. So it can be quite convoluted, basically.
That's very clever evolution on the tapeworms part.
Yeah, parasites are pretty tricky.
That's very clever. They're just working their way up.
Yeah. So I mean, it's probably worse in cats, realistically, because they tend to hunt more stuff than dogs do. But it's a sneaky tapeworm in that to actually kill the tapeworm, it actually takes 4 times the body weight tapeworming dose to kill that worm. So that's where people get confused about dosages on tapeworming, because sometimes the vet will say, okay, you need a 4 times the animal's body weight dose. So if you've got a 20 kilo dog, you actually need to give it 80 kilograms worth of tapewormer to kill Spirometra, and some vets in some areas actually recommend that you do that same dosage 2 days in a row.
Okay.
So you give them a fair whack of prazoquinol, which is a very safe worming medication, but that's what it takes to kill that tapeworm, and it's one of the really long tapeworms that we see, so up to like 8 metres long, convoluted up and down in a cat's intestine, and I mean sometimes they occasionally cause blockages and that sort of thing, but I mean most of the time we see people freaking out because they've got a bit of string hanging out their cat's butt when it's been in the litter tray, and it causes irritation and itchy bum syndrome and all that sort of thing, and if you've got enough of them, it causes weight loss and clinical symptoms, but it's mostly the ick factor that clues people onto there's something going on.
You can't miss when those are hanging out. It's a haunting sight. It's a haunting sight.
So it's in areas like the further you go north in tropical areas, it seems to do better basically, and all the tapeworms don't do well in freezing conditions. But if we're talking about Australia, there's not many places that are frozen much of the year basically. So it's always out there. But some areas have got, like some areas call it the gecko tapeworm, because gecko is really common, and the cats are eating geckos all the time, and they're getting Spirometra tapeworm that way.
Yeah. So how do people know what to do about this? Do you wait to see symptoms, or is it something you want to be preventing, or behaviourally what your animal is doing? Is that...
The Spirometra is a hard one. I mean, for me, if I had an indoor-outdoor cat, and I mean, I don't recommend indoor-outdoor cats because of the environmental things, and it's a lot riskier for the cats as well. But if I had an outdoor cat that had the possibility for eating stuff like that, I'd probably do a Spirometra tapeworming dose every 3 months.
Every 3 months.
As a preventative measure, or you don't do it every 3 months and you wait for Spirometra tapeworm to come along and hang out their butt and then cause troubles. But if your cat's an indoor-outdoor cat, I think justifying it every 3 month prazoquinol dose at 4 times the cat's body weight makes sense.
And what about with dogs?
Dogs are the same, as in same dosage mechanism. because dogs don't tend to hunt as much and eat as much stuff like that.
Yeah.
I find it pretty hard to justify doing a 4 times body weight dose, preventative dose every 3 months, unless you've had troubles before potentially.
Yeah, okay.
But it's probably in dogs more so a treat it if you need to situation with the 4 times body weight dose for the Spirometra.
So looking out for those symptoms.
Basically, yeah.
Yeah. Yeah.
And I mean, your vet usually can tell where the poop sample is there, worm eggs in the poop sample. If you take a fresh poop sample in, and one of the joys of life is to do fecal floats and poop samples and have a look for parasites in that.
That's something that's very, I love that we can do that.
It's interesting.
I think it's great. I think it's a really effective method, and it's not very costly to do it.
No.
And it's a great way to know what to treat for. So
So it's one of the preventative mechanisms that we can use for looking for parasites. It smells a bit, unfortunately, but
yeah. But isn't it cool that people can just bring you their dog's poop and you can see what's going on in there and know what to do?
Vet science is all about poop.
It's great. So that is the Spirometra.
Yep.
There's also Hydatid Tapeworms.
Yes.
What's their deal?
Hydatid tapeworms are really bad for people. Hydatid tapeworms terminate their life cycle in dogs and cats. The dogs and cats get the tapeworm in their gut and can have those troubles with weight loss and gastrointestinal upset and that sort of thing with having a tapeworm hanging out their butt. But the main problem with Hydatid tapeworm is if it gets in any other species other than cats and dogs, it insists in muscle or liver or abdominal tissue. It can be actually anywhere throughout the body waiting for another animal to come along and eat that muscle. So if it's pooped out through the cat or dog and gets out in the environment and little creatures end up with those little encysted tapeworms in their muscle, it often doesn't worry them, but in people it can cause hydatid cyst carcinomas basically, so they cause irritation in tissue, particularly the liver and abdominal cavity, and 10 to 20 to 30 years after you're infected you get cancer and it's bad, or cysts rupture into your abdomen and you get septic shock and all sorts of horrible stuff.
Case in point why they're my least favourite.
Yeah, they're not very nice. And I mean, if you're in a animal production system, cattle and sheep can be infected with those cysts and it causes carcass downgrades and all that sort of thing because no one wants to eat animal muscle with hydatid cyst in them. So it's certainly a problem and it's killed easily by your regular tapeworming program.
Cool.
But if you're in an animal production system, you certainly don't want your farm dogs or farm animals to be harbouring hydatid cyst infecting your livestock that then could potentially infect people.
Yes.
Yep.
So for us everyday pet owners, how do we prevent it?
Again, with your regular worming program, kills the worms, but I mean, how does your pet in town get infected with hydatid tapeworm? Freezing meat kills it. So if you're freezing your meat, that controls it. I mean, any animals that have been through the normal abattoir system should be inspected and make it a lot less likely that they've got hydatid cyst contaminating them. So, I mean, not feeding animals that haven't been through a abattoir system and being carcass inspected, etc. I mean, if your dog's out eating roadkill or something, or if you're capturing feral game and that sort of thing, and not inspecting it properly and not freezing it, there's potential for hydatid risk there. And some people like giving their dogs kisses and all that sort of thing, but if your dog happened to have hydatid tapeworms and licked its butt and then licked your face, then you've got a hydatid tapeworm which could kill you, so that's not very nice.
The deadly kiss.
Yes. So just think where your dog's mouth's just been.
Oh, I don't want. I know enough about where my dog's mouth goes to know that I don't want it near mine.
Yeah, I like my dogs, but they're not licking my face.
No. Yeah. Oh, yeah. We love them, but they are disgusting.
Pretty much. Yes. They've just been licking their backside.
Yeah.
Yeah.
That is a lower risk for sort of dogs and cats.
It's a low risk for the dogs that have not exposed to farm situations or animals, or eating animals that haven't been through a processing system, basically.
Yeah.
Yep.
Yeah. And are there any other types of tapeworm that we see here?
I mean, not many clinically. I mean, all species of animals have got their own tapeworms and got their own different life cycles. I mean, the Taenia ovis, which is the sheep measles, like it's a production system problem for sheep that if, again, farm animals, dogs and cats have got those tapeworms, it causes these little muscle cysts in the body, which doesn't cause hydatid cyst cancer problems for people, but makes the meat look funky. They call it sheep measles. So the meat actually has got little spots all through it, which is these little the little tapeworm cysts, which no one wants to eat or see, basically. No. So it's a production system problem. But again, if you've got farm animals, it's a good idea to keep them tapeworms so they don't spread any parasites to your livestock.
So with the hydatid and the Taenia ovis, what's the dosage for those?
So just the normal tapeworming dose on a 3-month basis, basically, every 3 months on a preventative basis. So it should interfere with the life cycle and shouldn't progress on to causing any troubles.
Cool. So it's just the Spirometra that's the 4-time dose, is
Correct.
that right?
Correct.
And everybody else is just your normal?
Correct.
Okay, well, that's not too tricky.
And there's a few quarantine things in Australia, like Tasmania, you need to have a couple of treatments for hydatid tapeworms before your dog can travel to Tasmania, and that's part of the paperwork, basically, because they haven't got hydatid tapeworms in Tasmania and they don't want them. And same as like New Zealand and some other overseas countries. So it's just, you'll find out about that if you try and move your dogs around. In Australia, there's a few little quarantine bits and pieces, but that's one of them. There's a vet has to administer the medication to, if your dog did have tapeworms, it stops them.
Yeah, cool.
Yep. But that's
great.
The vet's problem.
Yeah.
Yep. Not your problem.
No.
Yep.
So is there anything else about tapeworms that you want to cover before we wrap up?
No, that's the main things. I mean, they're nothing. I mean, they're horrible, and it's not a nice thing to think about. I mean, clinically, they're not like heartworms or hookworms that kill dogs really, really frequently. I mean, it causes discomfort and it can cause clinical disease. They're pretty easy to kill with a very safe medication. The main thing is, for me, it sort of changed a little bit, and vets' recommendations have changed a little bit because of the newer flea medications, where the flea medication gives really such good control over flea tapeworms that flea tapeworms have become less of a problem.
Yeah.
But if you're using those medications when you very first start them, I think it's reasonable to do a tapeworming dose before you start.
Yeah.
And if your dog or cat has any of the exposures for the Spirometra or those other tapeworms, certainly an every 3-month tapeworming dose regularly would never do any harm. Like, the medication is extremely safe.
Yeah.
Yeah.
That's fantastic.
Yeah, but if you're tackling Spirometra, you just remember that 4 times tapeworming dose.
Yeah. Yep. Cool, that's easy.
Yep.
Well, I sincerely hope that nobody ever has to see one of these things hanging out from an animal's butt or have to deal with them. But now you know what to do if you do and how to prevent that from being a part of your life.
Absolutely.
Thanks for listening. Hope you enjoyed all of our really disgusting talk. And if you have any more questions or you want some more info, you can check out our website, vetandpetdirect.com.au. We sell wormers that have the active ingredient praziquantel, and we have the help centre on there. We have chat where you can chat to us vet nurses if you have any other questions, and of course if you have any questions specific to your animal, have a chat to your vet.
Thank you. That's my wormy wisdom.
Your wormy wisdom. Thank you for sharing your wormy wisdom.
Thanks, guys.
Bye.